This video demonstrates the flush volumes required to visually clear blood and blood residual from two different needle-free IV connectors with clear housings. For the demonstration, we followed clinically accepted flush protocols. The ability to visualize the flush of your needle-free connector may allow you to determine if the device can be cleared with the recommended fluid volumes or if the connector needs to be removed, discarded, and replaced with a new connector after use with blood. In this sequence, we are using the ICU Medical MicroClave Clear Neutral Displacement Connector. Upon blood draw, you will notice blood residual inside the connector's straight internal fluid path. The syringe attached to the connector has been pre-filled with 10 milliliters of normal saline. When flushing the connector, you'll notice that the connector is visibly clear of blood long before the 10 milliliters of solution are completely utilized. Next, a syringe containing only 5 milliliters of saline is utilized. Upon flushing, you'll notice that even with a lower flush volume, the MicroClave is visibly clear of blood well before the full volume is administered. The low flush volumes required to clear the MicroClave eliminate the need to replace the connector after blood draw. A recent study indicates that the MicroClave can be flushed free of blood and blood components with as little as 2.5 milliliters of saline flush solution on average. Next, we flush the BDQ Syte Luer Access Split Septum Valve. The syringe attached to the connector has been pre-filled with 10 milliliters of normal saline. Upon flushing, you can see that there is visible blood residual remaining inside the fluid path of the valve. We attached a second syringe, pre-filled with 10 milliliters of normal saline to the same connector. After flushing with a second syringe, blood residual is still visible in the connector. The ability to effectively flush needle-free connectors after blood draws is extremely important for maintaining the catheter and minimizing the risk of catheter sepsis. The ability to visualize your flush after blood draws allows you to determine whether the flush is effective in completely clearing the connector of residual blood. INS guidelines recommend that if the connector cannot be cleared of blood, it should be discarded and replaced. Connectors that require replacement after use with blood because they cannot be effectively cleared increase costs associated with IV therapy and also increase manipulation, which in turn may increase the risk of contamination of the catheter. Of the connectors demonstrated, the ICU Medical MicroClave Clear appeared to be the most effective at clearing blood with low volumes. The low flush volumes of the MicroClave Clear are also appropriate for use with pediatric and neonatal patients, whereas connectors requiring greater flush volumes may not be. Testing proves that MicroClave connector is superior to any connector tested, as determined by the total flush volume needed to clear the connector of blood elements.